Hello, everyone, and welcome to my presentation on care and support for older person in the post-COVID-19 era. My name is Isi, Professor Israel Doron, and I would like to first start with thanking both you, the participants, and my colleagues, as well as Julia and Amal from UNDESA for inviting me and giving me the honor to share with you some of my thoughts. I'm a gerontologist, a law professor at the University of Haifa and the head of the Center for Research and Study of Aging at the University of Haifa in Israel. But beyond my academic and research duties and position, I also serve as a chair of an Israeli NGO called the Law in the Service of the Elderly. So my presentation here today also reflects some of my personal experience from my activist slash NGO perspective within my operation in the Association for the Law in the Service of the Elderly in Israel. My very short presentation will try to present some key insights, the experience from the last year's COVID-19, in a specific focus on long-term care support services for older persons. I would like to give a short warning because most of the arguments made in this presentation are not based on a broad systematic research-based data collection, etc. Neither do I have today a broad or very systematic analysis of the international experience in the field. However, there are a growing number of evidence, articles, studies in this field. And while there is still much further need to research and study and collect accurate data of what exactly happened in the last year, I think and I believe that there is a growing body of testimonies, evidence, and reports which provide some support to the key arguments and key insights that I will try to describe and portray in this presentation. So let's begin. I think that anyone who deals with the issue of long-term care support services for older persons already knows well the basic fundamentals. This is actually a very complex, diverse field, and the reality of care and support services for older person is very rich, very diverse. It includes a very broad and wide range of services and support systems which differ significantly across the world and from different countries, and even within single countries, they vary significantly between localities and municipalities and different regions. Eventually, this broad spectrum of both home and community, as well as institutional, both formal and informal, paid and unpaid, professional and unprofessional, provide a very complicated and diverse landscape of the field. And eventually, every country, every society, and even every locality and culture develops its own unique, contextualized mixture of long-term care and support services for its older population. Furthermore, I think it's quite recent to talk about the interrelations and the significance of human rights discourse within the context of long-term care and support services for older person. Historically, it was usually contextualized within this developments slash social policy context within a traditional paternalistic paradigm of older persons as being vulnerable or in a needs-based context, but not within a human rights discourse. And this has been transforming only the last decade, and we see this broad paradigm shift from from the dependency to a human rights discourse in the whole field of elder law only in the last 20 years, I would say. And even more slowly in the specific complicated world of long-term care and support services for older persons. So having and keeping in mind this arena or this context of a very diverse, complicated, and rich landscape of long-term care and support services, now we can dive more specifically into some very narrow and pinpointed insights with regards to what happened in this field in the last year in the COVID-19. Okay, so the first two insights regard what I would term a voice, inclusion, and participation. So the first insight is what I can say a macro level insight. And again, at least from my experience here in Israel, I can testify that in many cases, while shaping the national policies regarding long-term care and support services for older people, and the national strategies, how to combat and deal with the challenges of COVID-19 within the, again, shaping and reframing these services for older adults, older people were totally invisible. They were not including in decision-making. They were not seen as part of the process. Their voices wasn't heard. And eventually it was a classic top-down process where neither older persons nor their representative organization had any significant place, voice, or position within the decision-making process. The second insight, which is quite similar, but the loci of focus was on more micro-level decision-making and strategies. For example, within specific assisted living facilities, or within specific nursing homes, or within specific social services which provide long-term care and support services for older people in the community. Once again, the experience here in Israel was that in most cases, those local policies, local strategies, which try to address, sometimes in very difficult conditions, the ways to combat and address the challenges that COVID-19 has placed upon these services. But once again, despite many times good intentions and bona fide attempts to really provide solution in these extreme emergency situations, once again, the older recipients of the care, the older population, the older clients, the older partners, once again, were totally invisible, were usually unheard. Their perspectives, their wishes, their choices, their preferences were usually totally ignored simply due to the fact that they weren't there when decision-making processes were made. So the connection of these two quite similar insights about the centrality of the participatory element of decision-making and the place of the voice and the understanding of the right for inclusion was totally missing in the last year. And the question that I would raise and the insight for post-COVID-19, which I would like to propose, is that we should ask ourselves, can we imagine a world where older persons, in person as well as their representative organizations, are always equal partners in policymaking processes with regard to long-term care and support services for older persons? So moving forward beyond voice, inclusion, and participation, I think a very dominant and well-known phenomena, which was very implicitly visible during the last year, was the phenomena of age discrimination and the rise or reappearance of ageism as a social phenomenon. This was true not only for long-term care and support services, but in many other contexts of society. But in general, I would argue that many times older persons have been subject to ageism in general, but in specific in the context of long-term and support services specifically. In this broad context, older people have been labeled as vulnerable, unproductive, and branded as burdens for societies. In some cases, even blamed for all kinds of economic and financial outcomes, and were the ones whose fault, so to speak, was these outcomes. This was also expressed in various verbal abuse and negative images targeting older persons in the media and public debates. Once again, many times under the rhetorics of either an economic burden or under the discourse of vulnerability. In both cases, many times totally ignoring once again, the diversity, complexity, and the humanity of older persons on the individual level, as well as on the group level. So during the COVID-19 crisis, we, at least again here in Israel, we had many examples of discriminatory provisions against older persons within the long-term care and support services, many times using and adopting a simple chronological age as a cutoff detriment, excluding older persons from various services, or allowing younger people to continue to enjoy while older people are excluded, and other suggestions which many times only due to social resistance were not approved, but initially were suggested, again, targeting, excluding, stigmatizing people only because of their chronological age, grouping them together as elderly, hence excluding them from various services. And the underlying social understanding beyond all these policies and proposed modes of operations in the context of long-term care and support services for older people was the ageist, stigmatic underlying that older persons were worth less than other people, especially working people in the society. So once again, the challenge is the future with regard to long-term care and support services is, can we imagine a world where these services are provided on an equal basis without discrimination based on age, even in cases of emergency? The next insight, which follows up this notion of ageism and stigma and prejudices against older people as a group, maybe the other side or the other coin is the respect or disrespect for autonomy, personal choice, and control, which were provided or not provided within the context of long-term care and support services during the COVID-19. In many cases, again, at least here in Israel, during the COVID-19, older persons were prevented the opportunity to choose between the different options of long-term support services during the COVID-19. Some support and care services were simply totally shut down, some were abolished or closed, some were excluded or prohibited, while in other cases, the other side was that some or single options were presented and even mandated for older people. Here in Israel, for example, sometimes in order to allow to the establishing of COVID-19 specific departments in either general hospitals or even geriatric settings, geriatric departments were shut down or closed, or internal medicines units were closed or shut down in order to make place for a COVID-19 departments to be established. The outcome was naturally that in many times older persons specifically who needed or had need for to access various healthcare services with regard to the health condition other than the COVID-19 were simply not there, and they could not receive the appropriate medical care due to those policies which eventually prevented them the accessibility to those health services they needed. So once again, in general, but in specific in cases of emergency, how do we shape, adopt, and promise to allow older people within the context of long-term and support services to have and maintain their autonomy, to have and maintain their ability to choose which services to use. And even if there isn't much options, how do we can still control, and how do older people maintain their sense of self-worth and dignity while having the options to choose which, where, when, and by whom to receive their long-term care support services during times of crisis or pandemic. The next insight with regard to long-term care and support services for older adults relies on the position, role, and importance and significance of family members in informal care. Again, I think that we have enough data to support an argument that during the COVID-19 era, many times older people paid a heavy price as an outcome of quite harsh policies, which included social distancing, social isolation, and family disconnectedness. In this social context, COVID-19 has really highlighted the centrality and importance of informal care system, of family support in almost all aspects of lives of older persons, specifically those living in the community who rely on their daily lives on this massive and critical informal support by their family members. However, once again, during the COVID-19, again, in many cases, I believe, within these broad social policies to combat the pandemic, very little or relatively little attention was given to the rights of informal caregivers, to the rights of family care providers, and to the relationships between the rights of older persons and the rights of their family members. So once again, either they were totally ignored or not taken into account within the shaping and consideration of the various options and alternatives to the social policies to combat COVID-19. One indicator which was raised several times was the price that older people paid in the context of elder abuse in family caregiving context, where family member stress and burden was not taken into account, and the people who paid the price were the older people who were exposed to a much higher degree of cases or instances of elder abuse by their family informal caregivers during the COVID-19. So looking into the future and the post-COVID-19 era, it seems that we should or even must pay much higher attention to the rights of informal caregivers within the broader framework of ensuring the human rights of older persons as a whole. And finally, I think the last significant insight, which I think crosses borders and national localities, I think is that in general, the COVID-19 has exposed and supported the need to reframe, rethink, and revisit the whole way we think and conceptualize institutional and residential care for older persons within the discourse of human rights. And again, I think in generally, and this would not be any news, that reality has shown that nursing homes, in many cases, and not all, have failed to live up to their promises, to their expectations, or in their duties to maintain, protect, and provide human rights for older persons during the COVID-19. More importantly, or more severely, they have manifested their total institution characteristic in essence, in the way they actually infringed or harmed and dishonored the human and fundamental rights of older residents within their homes during the COVID-19 experience. And I think it's clear that any rethinking and shaping and conceptualizing human rights of older persons in the post-COVID-19 mandates us to rethink the whole idea of institutionalization and residential care as a legitimate part of long-term care support services for older persons on the one hand, and on the other hand, our mandate to re-emphasize and reconceptualize what do we mean when we use the term aging in place, or the right to age in place for older adults. Or in other words, how do we ensure that we can maintain or respect the rights of older persons to continue to live in their homes, in their communities, and in a sense abolish our future need for institutional care for older persons altogether when looking into the future. So to conclude, I think that in many ways, the COVID-19 in many cases only exposed and highlighted what we already knew prior to the COVID-19, saying that there is a normative gap with regards to the human rights mechanism protecting older persons in general. But more specifically, I think COVID-19 has exposed that there is still no common standard or benchmarks on how policy and legislation, especially in the field of long-term care and support services for older persons, should be framed, and how we should be legally and how they should be legally constructed as a human right. And there's still a lot of work to be done, how to operationalize exactly what do we mean in our human rights discourse within the context of long-term care and support services for older persons in general, and specifically in cases of crisis and pandemic. So in this sense, COVID-19 only revealed how deeply, in many cases, we are still rooted in ageist, stigmatic, and stereotypical approaches towards older persons when we come to the field of long-term care and support services. So once again, and continuing the same line of argument, it exemplified, and COVID-19 has exemplified how, despite the importance of universalistic human rights instruments, we still need urgently a particularistic, well-defined and tailored a new human rights convention for older persons. So to conclude or to summarize the main argument, in my view, the experience within the specific field of long-term care and support services has re-emphasized the need to transform the way we think, the way we talk, and the way we shape these services in order to fit what we truly mean when we respect and honor the dignity and human rights of older persons in the future. So thank you very much, and I hope that these insights have been of assistance and of help to these discussions on how to think and build the future of human rights of older persons in the post-COVID-19 era. Thank you very much for your listening, and thank you very much for giving me this platform.